Hi, I'm Dr. Gina Lundberg, and I'm a cardiologist and the clinical director of the Emory Women's Heart Center here in Atlanta, Georgia. And today I'm talking with WomenHeart Champion Barbara Fleeman.
Good morning.
Good morning. So glad you're here with us today.
Thank you. I'm happy to be here.
So we're going to talk a little bit about the importance of immunization, particularly the flu shot and the pneumococcal shot. And we're going to talk to Barbara about her personal experience with this. So Barbara's going to start by telling us a little bit about her WomenHeart Championship and advocacy and her personal experience with heart disease.
I'm a WomenHeart Champion. I'm a woman living with heart disease, as many of us are. And my advocacy is to help educate and support women living with heart disease and at risk for heart disease. So I'm here talking with Dr. Lundberg about the things that we need to think about and keep an eye on as we continue to be in control of our health as we move forward.
So Barbara, tell us a little bit about your experience with heart disease, what you've had, and kind of where you are now.
Okay. I have what's called coronary microvascular disease, which is a disease of the microvasculature on the other side of your heart. It's not a disease of the arteries, which most people get tested. I spent about 2 years going to doctors, complaining of chest pain, complaining of shortness of breath, complaining of all the signs and symptoms that I was experiencing, and telling them that my heart hurt, only to be told that there was nothing wrong with my heart. They would do the usual test, an EKG, a cholesterol check, a stress test. They did all what was considered to be the normal tests, and everything was coming out fine. They said, there's nothing wrong with your heart, Ms. Fleeman. But I knew that there was. I knew that there was something wrong. So at the end of 2 years, I finally was able to get to a cardiologist, and I thought, oh, this is great. I'm finally going to get an answer. I'm finally going to get treated. This nightmare is going to be over. And I went to this very well-respected cardiologist where I lived. He ran an enormous amount of tests, and I went in to see him a week later, only to be told, congratulations, Ms. Fleeman, there's nothing wrong with your heart. You're one of the healthiest patients I have. And I said, well, then why does my heart hurt? And he said he didn't know. And I thought, well, that's not an answer. So I left, and a few days later, I was able to find the Women's Heart Center at Cedars-Sinai Hospital, which is where I was living at the time in Los Angeles. Was able to get in touch with Dr. Barry Mers, who was the head of the Women's Heart Center, went in to see her and her staff, and was immediately diagnosed with coronary microvascular disease. I asked her why the other cardiologist didn't know about this, didn't diagnose me. There was a test that she gave me, a coronary MRI with stress, and that's what diagnosed it. And I said, well, I went to another cardiologist. Why didn't he know to do that? Why didn't he do that? And unfortunately, this type of disease is one that is very common to women, from what I found out. Very commonly goes undiagnosed because it doesn't show up in the normal coronary testing that doctors do. And it's just something that, I had to stay on top of and educate myself to take care of myself.
So what she's talking about, coronary microvascular disease, is more common in women, but it can happen in men. And it's when the large arteries of the heart have normal blood flow, but the smaller distal vessels from them, what we call the arterioles, aren't responding normally to stress or different situations, even exercise, and so they don't dilate when they should. It's not that they're blocked, they just don't respond properly with the proper dilation and contraction. And it causes the same symptoms of angina.
Right.
And unfortunately is also associated with higher morbidity and mortality. It can cause heart attacks, it causes heart dysfunction, and does need to be identified and needs to be properly treated. Unfortunately, it is something that's been newer in the literature, really getting more popular after 2010, but from the 90s through the early 2000s, a lot of people didn't know about it. We don't want to dismiss someone's chest pain just because the angiogram or the nuclear stress test is normal And there are special testing that can be done, and we do it here at the Emory Women's Heart Center. But sometimes you do have to find a specialist in women who can identify this.
Mm-hmm.
And I'm so glad you saw Dr. Noelle Berry-Maris. She is
Yes.
a leading researcher in this area, and really has done the lion's share of the work on this. And so you are at, you've been treated by the right person.
I got very lucky. She was absolutely amazing. It was as if when I walked into her office and told her what I was experiencing, she knew immediately. It's as if she had seen this so many times before. Women coming to see her when they're totally broken and sick and no one will listen to them. And they tell her what they've been through, what they're feeling, what they're experiencing. And she knew immediately. She knew immediately what it was and how to make me better.
And you are on medication for this now?
I am. I'm on medication for my overall heart issues. I'm on blood pressure medication. I do have slightly elevated blood pressure. It's not that bad. And initially, I was actually able to be a part of a clinical trial that she was running on a special treatment for symptoms of microvascular disease. It was called the RWISE study. And I was part of that test. So I'm actually at the point now where I'm not on any type of medication for the microvascular disease, other than maintaining a healthy diet and exercise. Exercise is a very important part of staying on top of microvascular disease because of the endothelial dysfunction that causes mine in particular. And exercise is a big part of it. So I'm on very little medication because everything else is kind of healing on its own.
Good. So heart disease in women can be many things, from coronary artery disease, that's the blocked large arteries, cardiomyopathy, that's where the heart muscle is affected and not functioning properly. There's valve problems, there's electrical problems, there's many things that contribute to heart disease in women. But there's a few things that help almost every woman with cardiovascular disease. And as Barbara pointed out, a healthy lifestyle is really important. Exercise, healthy, nutritious foods, keeping your blood pressure low, keeping your blood sugar controlled, keeping your blood cholesterol levels at an optimal level, getting enough sleep, drinking enough water, not having any sleep disturbance like sleep apnea, many things. And then of course the things we talk about a lot: don't smoke, controlling diabetes, high blood pressure. And then there is a genetic component, and it's probably responsible for about 20% of heart disease, as you simply get it from mom and dad, and it's not really anything you've done in your lifestyle. So some newer information that we've been getting for probably another 15 to 20 years is the role of inflammation in heart disease. And inflammation is very important. It's part of what adds to the atherosclerotic plaque. It's part of what makes the plaque unstable so that you can have a heart attack or a stroke. And it's a very important risk factor, risk determinant for heart disease, but it's also something we want to lower in general. Mm-hmm. Well, interestingly, we are learning that avoiding the flu, avoiding pneumonia, and even this summer there were a lot of studies about shingles, another inflammatory viral illness. When we have these illnesses, we are increasing our risk for a heart attack, but also stroke. So we're really becoming strong advocates throughout the whole American Heart Association, American College of Cardiologists, that all of our heart patients should be getting the flu shot every single year, and the pneumonia shot every 10 years, and then when you're the proper age, the shingles vaccination, and that's, we believe at this point, once, although we tend to change things, so check back in 10 or 15 years on that. So why is this so important? So if you get the flu, you have a good chance of that turning into pneumonia, you have a good chance of that worsening congestive heart failure, and you have a good chance of that increasing your risk of a heart attack. So simply avoiding the flu reduces your risk of a heart attack. But it's really more than that. So you may say, I never get the flu. I don't need that injection. And a lot of people say that. And maybe you never have. But it's a bigger role than that. So when you visit a friend who might not be as healthy as you could carry them the flu if you got it. You could get it from a child, a neighbor, someone at church, someone that's coughed on the chair that you sat down in at the restaurant, and then you could get it. But you could also be a vector for giving it to someone else. So it's more than just you. We want you to get it as more of a public health issue, so that if you don't get it, you can't give it to anyone else. Also, for some women, and this might not apply to you, Barbara, but most women, we're caretakers, right?
Yes.
We have our children, we have our mom, our dad, our brothers, our sisters, the people in the office. So when you're not here doing your job because you're home sick, there are other people who may be affected by it. Or if you really have an elderly parent or someone that you're caring for, or unfortunately a sick spouse, then they're not going to benefit from you being the healthy caretaker as well.
True.
So we really advocate it as a public health issue, but also as a personal heart disease issue. So we want you to get the pneumonia shot. If you get pneumonia, you have a very high chance of being hospitalized and even having death associated with that. So we don't want that. The flu, for those people who've had it, they know how miserable it is. I've had young people who don't get the flu and then they get it once and then they're like, I will never do that again. And that's how bad it feels at 25. So when we're over 50, and we won't mention any ages here today, but if you're over 50, you're 60, certainly 75, 80, it really could be not only you're laid up in bed for maybe 2 weeks, but you can be seriously ill and be hospitalized. So we do want that. So when you get the flu shot, you prevent that inflammation associated with the influenza virus, and you reduce your risk of heart attack. Now,
Good to know.
You didn't know that before today, or you didn't know that till recently, right?
I did not know as much as in depth as what you're explaining. I've been a very bad patient.
No, don't say that. But Barbara, I do want you to share with us what got you to get the pneumococcal vaccine, which you did get.
I did get.
And how you felt like the medical community just wasn't informing you about this. So tell us about that experience.
Right. The medical community has done a good job of informing us about getting a flu shot every year, and what flu is out there this year and why we need that shot. So that's done a good job. With the pneumococcal vaccine, I didn't know anything about it except for when at the beginning of May, I broke both of my ankles and was in the hospital. Went into the hospital, and as they were treating me in the ER, the nurse was going down a checklist of things and asked me had I had a pneumococcal shot. And I said, no. And she said, do you want one? And I said, no. It was just very, very off the cuff. It was like, do you want fries with your broken ankles? So, and she didn't explain to me what it was. She didn't explain to me why she was asking. She didn't explain to me what it would do and why I needed it. A month goes by, and I actually had to go back into the hospital to have surgery on one of my ankles. It was within that month, I got very lucky, it was within that month that I came across some information through my association with WomenHeart of the importance specifically of women with heart disease getting the pneumococcal vaccine, because we are at higher risk of getting pneumonia and the heart failure and the heart attack and the issues that come along with that. So when I did go back into the hospital at the end of May for my surgery, once again, the nurse came in and asked me the same question in the same manner. And this time I said yes, because I knew this time what it was and why I needed it. The frustration, and I waited for her to tell me, to explain it to me before I even answered, did I want it or not? And she didn't, so I said yes. And then I looked at her and I said, why do I need this? Because I needed her to explain it to me. I wanted to make sure that that part of the conversation took place. Mm-hmm. And I said, why do I need that? And she kind of explained to me that it was just, it was protection against getting pneumonia, which was great. So I said yes. So yes, I did have my pneumococcal vaccine done, and I'm glad I did.
And I'm glad you did too. So there are a few times when you don't want to get the injection. So I've been seeing patients here in the office since August. We've done over 100 flu vaccines. But there have been a few patients I said, I think you need to wait a few days. So if you're already feeling under the weather, if you already have the sniffles, think that maybe you're having a cold coming on, maybe you're fighting off a urinary tract infection, you've just been on antibiotics. If there's anything that has compromised your immune system, you want to wait. You want to wait till you're fully healed because you want your immune system to be able to create all of these antibodies to the flu vaccine. And if they're busy fighting something else, you won't get a good response to the vaccination.
What if you're going in for surgery?
So if you're going in for surgery, it's probably not the ideal time to do it.
But they asked me if I wanted it, and they gave it to me.
I understand, and that's because you're in the hospital, and it's a metric that the hospitals have for being rated as a good quality hospital. So they give it to they like to give it to everybody while you're there, and they get a little check mark that they gave it to you while you're in the hospital. But it's not always the ideal time to get it because after surgery, your body's busy healing up your ankles, responding to that, and you need your immune system working there.
So you can get it from your doctor. You don't have to wait until you go into the hospital.
You don't have to wait. And if you've gotten it through your doctor, when you're at the hospital, you just say, I've already gotten it at my doctor, and they still get a check because they asked you if you had it.
Oh, I wish I'd known that.
Well, that's why we're having this today,
Yes.
to educate the WomenHeart community. So if you're under the weather, don't get your flu shot. Come back a few weeks later. We start giving them as early as August 1. We like for you to have it by Halloween. You can have it later in November or December because flu season really hits in January, but you need it early enough to build all those antibodies. So I have one last question for you, Barbara.
Yes, ma'am.
Do you want your flu shot today?
Yes, I do.
Oh, good.
Thank you, Dr.
All
Lundberg.
right. And thank you, Barbara. and
Thank
thank you,
you.
WomenHeart, for this great discussion.